Good evening, everyone. Hello. Good evening. Good evening, everyone. The first line of this is really good. It says, hello and good evening. I am Nancy Giles, but I'm not Nancy Giles. Nancy's a little bit delayed, so I'm stepping in for the moment. I'm Joshua David. I am Lisa David's brother, standing in for Nancy Giles. So welcome, everybody. I'm so glad to see you all here tonight. As your host in Nancy Giles' place for tonight's 2022 Health Reimagined Gala. Some of you won't recognize me from CBS News this morning, where I am not a comedian and actress. Blah, blah, blah. It is, I think on Nancy's behalf, she wanted to say that it was one of her first in-person events after 2 years and how wonderful it is for people to gather again in person. And I can say that from my perspective as well, how great it is to have gatherings like this again. It's been such a long time, and it's such a privilege to be all together in this beautiful setting with such inspiring people. We have a great show planned for you tonight. Throughout the evening, you're going to hear more about public health solutions and their work, with a small glimpse into how this wonderful organization improves the health of New York City's underserved communities and low-income families. As the pandemic continues to impact New Yorkers and healthcare rights are under attack, public health solutions work has never been more important. You will hear about their work this evening, and there is an easy way to support their work. We have these table cards placed in front of you at your seats. I don't have one, but you have them at your seats. Simply scan the QR code on the back of the card and you can make a donation online, and I hope you'll do that. For something that won't cost you any money, we also have a photo booth going on in the back of the room. I believe it's over there. Don't forget to cram as many friends as possible into one memorable photo of the night. And yes, the photo booth is here throughout the night, so take as many pictures as you would like. At the end of the evening, we'll be hosting a dessert reception in the cocktail area. We're excited we have an exciting evening ahead of us, so without further ado, and this is where you really need to pay attention, because now you didn't need to pay much attention to me, but now you have to pay attention. Now you have to pay attention. So we have a very exciting evening ahead of us. So without further ado, let's welcome on stage my sister, first of all, but Public Health Solutions President and CEO, Lisa David.
Thank you, Josh. As indicated by the level of traffic, New York is certainly starting to come back. So Nancy should be here, but she's caught in a little traffic jam. So, we're here, live and in person. I hope you've enjoyed seeing colleagues and friends. I know I have, and I haven't even seen you all yet, but it's been wonderful, wonderful to be able to give some hugs and see some people. So on behalf of the board, management, and staff, I just want to thank you all for coming and to welcome you to our 2022 Health Reimagined Gala. Also a warm welcome to the attendees joining us from home. There are an impressive group of leaders here in this room and colleagues. It feels so wonderful to see you all in person. And this is our first gala, as Josh said, for 2 years since the start of the pandemic. We're thrilled you ventured out to come to join us. We've canceled this for 2 years. I don't think we were going to be able to do that again with Tribeca 360. So we're very excited to launch Whole You NYC, which you're going to learn more about tonight. That was the theme of this event, but I feel I can't move forward without reflecting on the fact that we're here tonight in a very different country than just last week. Last Thursday, the Supreme Court struck down New York State's restrictions on carrying guns outside of the home. And then, the next day, they overturned Roe. It's clear that the country is less safe and that people who are marginalized will feel the impact the most. It's also clear that's just the beginning. There are other plans ahead. And as usual, it will fall to organizations like PHS and many of the other organizations represented here in the room to help clean up the mess that these decisions are made. And will the inequities that were laid bare, made obvious to everyone in the country, that were the result of the pandemic, are we going to see a shift in funding? Are we going to see a shift in policies? At least so far, it seems like no, just on the edges. We're going back to normal, and normal was not good enough. But PHS will be on the ground, totally committed to working with our community partners to ease the burden on those most effective, with your help. So now on to our regularly scheduled program remarks. For over 60 years, Public Health Solutions has transformed the lives of hundreds of thousands of New Yorkers and worked to ensure that everyone has the opportunity to live a long and healthy life. The last 2 years have been extraordinarily challenging. Within days after the first case of COVID was reported in the state of New York, on March 1st, New York City went into a lockdown. Public schools were shuttered, and life as we knew it changed forever. As New York City quickly became the epicenter of a massive public health crisis and unemployment skyrocketed, hundreds of thousands of New Yorkers found themselves in desperate need for essential services such as food, housing, and health insurance. Scores of pregnant women were faced with looming uncertainties about the risks of delivering in a hospital and caring for their young children. And thousands of young people were left without access to sexual and reproductive health. The pandemic has tested the resolve and resources of every single public and private organization that makes up the healthcare and social services ecosystem in New York City. So many of us were affected by job losses, budget cuts, rapidly increasing bills, on top of isolation and the mental health impacts that were the result of the pandemic. But New York City has proven time and time again its resilience in the face of tragedy and devastation. 9/11, Hurricane Sandy, COVID-19. Even though the future was uncertain, we all reached out to help our neighbors, and just as PHS has been showing up for the last 60 years for the health of New York City's underserved residents, we too stepped up and swung into action to match the needs of the moment. We proactively adjusted our programs to offer virtual supports by telephone, by telehealth, to ensure that there was no disruption in services for those who rely on us. We launched a digital portal to allow New Yorkers to safely connect with services needed. Beyond enrolling in our own services, access to food through SNAP, food stamps, and WIC, food for pregnant women and young children, we enrolled people in health insurance, and continued access for maternal and early childhood development. The portal also allowed our staff to connect New Yorkers to a host of other services that were in need and provided by our partners, like housing, mental health, legal support, and many more. COVID-19 was called the great equalizer in many early reports, a disease that transcended wealth, fame, prestige, gender, and age. We were all at risk, but as we know, we were not impacted equally. Communities of color and low-income New Yorkers were the hardest hit. And these are the very people that PHS has served for decades, and ones we have been bridging the gap in care for one step at a time. Even as the pandemic remained front and center as a most urgent public health crisis, we can't ignore the others either. Some were a direct result of the pandemic, while some others were a result of systemic issues for decades in the making that have only gotten worse. Rising food insecurity, deteriorating federal safety net programs, unprecedented gun violence, climate change, lack of affordable housing, all got worse. Well, actually, climate change probably got better, but it's back. Just like the early days of the pandemic, I can assure you that we are here to step in with the rest of our colleagues tackling these urgent issues. And we are ready to fight for and serve every New Yorker that has needs. I am proud to lead an organization that had and continues to have the vision and experience to take on the biggest public health challenges of our lifetime. Our work is supported by our partners, our donors, and our staff. Tonight, we're here to honor such partners, our champions of public health, for their work in ensuring that New Yorkers did not fall through the cracks at a time when help was most needed. Our first honoree for tonight is Dr. Olusimbo Ige. She's the Assistant Commissioner for the Bureau of Health Equity Capacity Building at the New York City Department of Health. PHS has worked very closely with Dr. Ige throughout the pandemic. Our second honoree is Bronstein Properties, a family real estate management company that has been committed to making an impact in the communities in which it operates. You'll hear later how Bronstein Properties has been supporting PHS. We are really thrilled to recognize and applaud their inspiring work. I want to take a moment to also recognize the organizations who have provided generous support for today's event. A special thank you to tonight's pioneer sponsors, Epic, Health First, Hyphen, and New York Presbyterian Hospital. I also want to thank all our donors and potential donors who make our work possible. Your contributions provide the critical flexibility that allows us as an organization to support New Yorkers in need as we work to build back better, stronger, healthier, and a more equitable New York City. I'm now going to turn it over to Diana Mason, Senior Policy Service Professor at George Washington University School of Nursing. Diana is a board member of Public Health Solutions and has long championed our cause with her incredible work on our development and program committees. She's the kind of person who jumps in when she sees a problem and has recently stepped up in her community to establish a community health center in the Catskills, where now there are none. That's just who she is, and this is her. Diana.
Thank you. Thank you, Lisa, and good evening to everyone. On behalf of the Board of Directors of Public Health Solutions, I'm delighted to join Lisa in welcoming everyone to the 2022 Health Reimagined Gala as we gather today. Yes. As we gather today to honor champions of public health. As Lisa reflected, as we all reflect back on the last 2 years of the pandemic, we have to reckon, we must reckon with the fact that the pandemic exposed deep cracks in our city's health and social services and support systems. It magnified the structural inequities in ways we knew existed. I have an African-American nurse colleague who shared with me her anger and profound sorrow when both her mother and father-in-law died from COVID. Now, maybe they would have died from COVID anyway, but she believed, and I believe, that there were disturbing disparities in health care that made their passing inevitable. And her mother had to be sent to a rehabilitation center when she couldn't get the social services she needed to stay at home to recover from an injured, not broken, an injured ankle. She got COVID at the rehab facility, care that bordered on neglect, including severe dehydration, and died. The pandemic caused the pillars of support that we as a society relied on for good health to crack under the pressure, thoroughly shaking our foundation. Now, as we look back at the last 2 years and brace ourselves against the attacks on healthcare that are happening in the present, we have the opportunity to do more than just repair. Instead, we can, and I believe we must, reimagine and rebuild systems, pillars, and processes. It's not going back to normal. As with every other crisis in human history, the pandemic has reshaped our practices, priorities, and perspectives. It's also affirmed that achieving health equity for all New Yorkers requires bold action. The challenge is urgent and it's big. I'm proud to say that Public Health Solution is doing just that with their commitment to revolutionizing community health and improving the lives of millions of New Yorkers. Thank you once again for supporting this important organization, and do please scan that code and make a donation, and for joining us this evening to celebrate work at reimagining health. I invite you to learn more about Public Health Solutions' work, our partners, and how your contributions are helping to advance health equity in New York. Enjoy your evening. Thank you.
Hello and good evening, everyone. My name's Nancy Giles. I'm just going to say I'm so delighted to be here, and you might know me from CBS News Sunday Morning, and I'm so sorry that I'm late. I got locked out of my house, and it was just one of those funny things. So let me just press on. Lisa and Diana, thank you for your glimpse into how Public Health Solutions rose to the challenge posed by COVID and continues to show up for New Yorkers through other public health emergencies. Yeah, give it up. You guys rock. In many ways, this is a crossroad moment for change, and as Diana mentioned earlier, achieving health equity for all New Yorkers requires bold action. So now let's welcome on stage Zachariah Hennessy, Public Health Solutions Executive Vice President and Chief Strategy, who has a couple of exciting announcements for all of us. Crowd applause, it says. Oh, it's going to be on your video screens, I guess.
Very warm welcome to all of our attendees today. Today has a lot of meaning for me because two big things are starting. First, my partner Rob and I are so sorry we can't be with you in person. We have been down here in Florida awaiting the birth of our baby, Noah, who arrived a few days ago and is on his way to becoming officially the newest member of our family. Please keep us in your thoughts as we continue to navigate this adoption journey. And second, I have the privilege to launch with you an exciting initiative that has been the culmination of several years of work at Public Health Solutions to advance our vision of health equity in New York City. As my partner and I embark on this hopeful and challenging journey of becoming parents, I think about my own mother. As a teenager, I found her journals and discovered that during her pregnancy with me, she was informed of a potential heart condition and referred to a cardiologist. but she was uninsured and worried about affording health care. References to feeling weak and having chest pains appeared in entry after entry in her journals, alongside worries about money and employment. 5 years after I was born, her condition became an emergency. She was diagnosed with rheumatic fever and died following open heart surgery. By the time they operated, her valve was too damaged to repair, and she was only 31 years old. As a prospective gay parent, I also reflect on the job I took after graduate school, working with runaway and homeless LGBTQ youth in the South Bronx. Many of these young people were kicked out of their homes or ran away because of their gender or sexual identity. Most had been mistreated by the education, health, and social service systems. Spending every day with these young people, I came to see that many of their challenges were rooted in their environment, in their neighborhoods, and deep in our nation's history. These two experiences I've shared are examples of what we mean when we talk about the social drivers of health and health equity. And I'm sure many of you here tonight, with some introspection, could come up with your own examples. It is not surprising that in the US, only 20% of a given health outcome is determined by what happens within the four walls of a healthcare facility. The other 80% is determined by things like access to healthy food, housing, transportation, education and jobs, social and physical activities, and more. Collectively, these factors are known as the social drivers of health. This is why we say that health happens in homes, in communities, and in neighborhoods. If you think about your own life and your loved ones, this may seem obvious, but surprisingly, over the years, our public policies and investments have given much more weight to clinical care than to the social drivers of health. Here in New York City, because of pernicious inequalities, including those stemming from racism and other injustice, we experience extreme differences in social, economic, and environmental conditions across our neighborhoods. And these differences underlie the health disparities we uncover when we measure public health, such as the 11-year difference in life expectancy we experience between the Upper East Side in Manhattan and Brownsville in Brooklyn, an avoidable hospitalization rate in the lowest income neighborhoods that is 2 to 3 times higher than that of New York City overall, and the significant and persistent racial and ethnic disparities in chronic disease and life expectancy. So neighborhoods have long been our focus at Public Health Solutions. They are also where our solutions reside as we look forward to a better future for New York City. Because health happens in neighborhoods, having local community-based organizations as partners is essential in advancing health equity. The good news on that front is that there are wonderful and diverse community-based organizations across the 5 boroughs working to improve neighborhood conditions and empower New Yorkers to achieve their goals, offering food and nutrition, benefits enrollment, legal services, childcare, housing support, behavioral health, opportunities for social engagement and community activism, and so much more. These resources can be life-changing, but are often disconnected from one another, uncoordinated, or difficult to access. As a result, many people remain unaware or disconnected from supports and opportunities in their own backyards that could change their lives and health for the better. Additionally, if and when people do seek healthcare, their typical encounters do not include discussions of their health-related social needs. Some healthcare providers have begun to introduce this, but without a trustworthy and reliable solution as a next step, their options are limited and they lack the confidence they need to refer for non-medical services. When disconnection, fragmentation, and lack of access occur, New Yorkers can be left out, left behind, or go unseen. That is why I'm so excited to announce to you tonight the launch of Whole You NYC, a coordinated, accountable network that has already begun to address these challenges in New York City. Let me tell you about what Whole You NYC does. It is a one-stop shop that brings together more than 300 community-based organizations and their resources on a technology platform, Unite Us. The network has both healthcare and community access points and allows for real-time, collective communication and referral making across health and human services organizations to better coordinate and ensure people's needs are really met. Whole You NYC helps New Yorkers by providing the services and resources that they need. The relationships we have built with community-based organizations and other neighborhood resources have already begun to make an impact. Our network has increased access to home visits for pregnant and newly parenting families in Queens. It has reduced food insecurity among public hospital patients in the Bronx, and connected seniors residing in public housing to resources and activities that address social isolation, a really important issue. When COVID-19 hit and our communities were scrambling for resources, PHS and our technology partner, Unite Us, responded by moving from small, narrowly focused networks to a broad, citywide network in just a few short months. Since then, we have seen considerable growth in both organizations joining the network and people seeking and being connected to our resources. And we are already helping nearly 1,500 New Yorkers each month. That's 50 people we are supporting every single day. The U in Whole You NYC is intentional. Our participants trust us with their stories, and so it is our obligation to be guided by a philosophy that ensures no part of them or no one is left out. The new name and brand emerged in part thanks to a collaboration with Health First, a large nonprofit health plan. Together, we sought to improve the clinical outcomes for their HIV-positive members by focusing on each member's most pressing life priorities rather than just clinical care and medication adherence. We chose not to focus on the disease, but instead on the whole you, trusting that if we tackled the most pressing concerns of members, improvement in their medical condition would surely follow. And it did. We found that this engagement with members correlated with an improvement in members' HIV viral suppression. We are now putting all the knowledge we gained to use on a larger scale. Our vision for Whole You NYC is to create trustworthy and reliable pathways for people across healthcare and human service settings that deliver the right resources at the right time to achieve and maintain good health. We are creating a network of healthcare providers and organizations that can give people the resources they need. This is especially important for New Yorkers who don't have insurance or don't have a doctor. With new opportunities for financing on the horizon through New York State Medicaid, as well as new federal initiatives focused on pandemic resilience, we are working to build a new, innovative safety net that is more resilient and connected. This will help people in New York City have better access to resources and help to advance health equity. As Diana mentioned earlier, this is our opportunity to rebuild a better system of care. And so I hope you will all join us on that journey today by supporting PHS. Not only are we building a network that is empowering people today, but we are advocating for the policy and resources that will advance this work tomorrow. I would also like to thank many of our key partners who are here tonight, including our partners in government, philanthropy, and the healthcare sectors who have been such crucial supporters of this work. And I would especially like to express our gratitude to community-based organization partners who have been showing up in tremendous ways to help people under very challenging circumstances. Thank you for being here. It really does take a village, and New York City is quite the village. We couldn't do any of this without you and value your trust. I encourage everyone here tonight to join Whole U NYC in our transformational effort. So please contribute what you can tonight. Visit our new website at wholeu.nyc, add yourself to our mailing list, or express your organization's interest in joining our network. Our vision with Whole U NYC is to make good health more accessible for every New Yorker, and along the way to inspire change, not only to make our city a better place, but also to advance health equity and build a future we can be proud of. I hope you will all join us tonight in bringing that vision closer to reality. Thank you.
All right, folks, you know what to do. Like Zach said, it truly does take a village. Now, we heard a little bit of how Whole U New York City was created, but now it's time to hear from those who are at the front lines of this work. Please join me in welcoming Gabrielle Miller, who's one of Whole U New York City's team leaders who take the vision that we heard from Zach and put it into action. And she looks gorgeous, so give it up for Gabrielle Miller.
Hello, everyone. My name is Gabrielle Miller, and I am a Whole U NYC team leader. Although the New Yorkers I connect with and help could not be here tonight, I hope that by telling you their stories, you will understand just how much Whole U NYC already means to us and them. What we do at Whole U NYC boils down to this. We take care of people who are overwhelmed and need help with necessities. One of my patients, Ruby Jackson, is a good example. Ruby is 73 years old and illiterate. Her son, Kenneth, is 53 years old and has a disability, rendering him unable to talk. With no family, friends, or spouse, Ruby had been at a loss, and she was worried about having enough to eat. During a checkup, Kenneth's PCP screened him for food insecurity and referred him to a social worker. But even the social worker was having a tough time with his case and referred both Ruby and Kenneth to PHS. When Ruby connected with my team, we were determined to help her and Kenneth. The first thing we noticed about each other was our shared heritage. Ruby is Jamaican, and I am Trinidadian. We formed an instant connection, and I can tell by talking to someone who sounded like her put Ruby at ease. Often with the people I help, we use email to fill in a variety of forms to gather information together. With Ruby, this was not an option, and I soon discovered it was the main reason why she was struggling to receive the help she needed. It was a challenge, but her social worker and I were determined to help. Instead, I got Ruby on the phone and started to work on her needs. Our top priority was connecting Ruby with food resources. We successfully connected Ruby with a food pantry. We also reopened her SNAP application, which had unfortunately expired because Ruby could not read the messages sent in the mail. Once Ruby was set up with food assistance, we also recertified Ruby for Medicare so she can have her health insurance. We then focused on Kenneth. We got him enrolled into Social Security disability insurance. Then we connected Kenneth with home care and daily living supplies. Ruby came in for one need, but we saw beyond that one need and offered to help. That's the level of service we provide here at Whole You NYC. We have continued to stay in touch with Ruby to make sure that her food deliveries are coming every week and her disability checks are being delivered. Whole You NYC is not just about getting the job done. It's about offering the services that a patient has also asked for. It's about listening and doing the best you can for the whole person. Every month, my team of 4 sees over 600 patients. Some days it can get overwhelming. There are thousands of people out there like Ruby who are struggling to navigate a complex system of resources. Sometimes we are unable to help, but we make sure to listen to every single person who calls us and try our best to help. What helps me tremendously is knowing that there are more positive outcomes than negative. I am so proud of the work that our team does. My brother, Clevlon, who could not be here today, also works with me on the Whole You NYC team. In our family, we have a strong belief in helping others. We are here because someone helped us, and we are carrying that forward. Thank you once again for coming here tonight and supporting our work, and have a good evening.
Thank you. Folks, my name is Charles Anton. It's a pleasure to be here tonight. This is the first gala since 2019, if you can believe that. That is truly stunning. And as you heard from Gabrielle and Diane, the need is greater than it's ever been. And we have really an ask tonight. We don't have an auction. What we have instead is an ask. Now, this is extremely, extremely important because it's one of the main reasons we're here tonight to support Public Health Solutions' work that they have done and work that they still have yet to do, facing the challenges that they have in the new reality also of the past few weeks. Things are constantly changing. But the paddles did not make it tonight. I was told it was a supply chain issue. So we're going to do this the old-fashioned way. So I am going to ask for your attention here. And how this is going to work, nothing to auction again. What we're going to do instead is we simply have an ask to support PHS at every different level. And we're going to start at our top number and work our way down until we've found a level at which everyone here can participate at some level tonight. So because we don't have paddles, because they're somewhere on a tanker halfway across the Pacific, wherever they may be, we're just going to ask you to raise your hand. Hopefully from the 2019 gala, everyone remembers how to raise their hand. And what I'm going to ask you to do is keep your hand up until one of our volunteers and one of our staff members has come over to you and taken your name. Can you guys raise your hands around the room? There's about 8 of them all around the room until they've come over to you. Now, if you are more comfortable, you can also scan that QR code on the back of these guys right in front of you. But we would ask you to raise your hand too, just so we can keep track of you. And I'm going to try to keep the running total in my head. We'll see how that goes. So to kick things off tonight at our top level, is anyone willing to say $10,000 for PHS? Thank you, sir. Well done. Table number 11, we have 1 at 10. Table number 4, the gentleman seated here at table number 4. Thank you, ma'am. We should work together. Table number 4, we have a gentleman right here. Remember to keep your hands up until someone has come over to you. Table number 4 right here in blue. That's $20,000 to kick it off. That's not bad. Thank you very much. All right, let's move on then. Anyone else at 20? Should I have started higher? Should I have started at 25,000? No? Yes, I should have. Is that a bid, ma'am? No? One day, Jeff Bezos will be at a gala in New York City. I promise you that, and we'll get it. All right, our next level, 5,000. Who will say 5,000? We're at 20. We have 2 down front. Keep your hands up. Well done, folks. That brings us at 2 more at 5,000 each. That, folks, is 30,000. Are you giving 5 as well? Oh, you wanted to give 15? Oh, you raised your hand at 10. What happened? You reconsidered? All right, you reconsidered. All right, so we have 15, that's 25,000. Well done, we're at 25 and counting. Anyone this side at 5,000? So we had 3 at 5 and 1 at 10, it turns out. He's actually removing money from PHS. We are taking money away from Public Health Solutions. Anyone else at 5? We're at 25 and counting. All right, let's move quickly then. Keep your hands up until someone gets you. How about 2,500? We're at 25,000 and counting. Who will say 2,500? How about just an awkward silence with nobody? That's not helpful to me. Anyone at 2,500 to get me out of a jam? I'm going to move quickly then. Anyone at 2,500? All right, our next level then. Is that over there in the corner? Oh, thank God, sir. It's been 3 years. I knew we had someone at $2,500. Sir, I'm going to tell you what, sir. I'm going to have them move you to the front for the 2023 gala. I promise you that, sir. Well done. All right, we're at 27.5. Our next level is the level at which if you, for example, bought a table tonight and invited like the junior associates at the firm, for example, and they're enjoying these beautiful views of all of Lower Manhattan for free, this is when you should be glaring at them. Pay for your dinner tonight, folks. All right, how about $1,000? We're at 27.5. Gentlemen seated right here, that brings us to 28.5. How can we get over the 30 threshold? That's 2, that's 29.5. One in back, that's 31.5. Thank you, sir. Actually, 30,500. And one right here? No, I got him. Is there someone else? But thank you for your help. We could take this on the road together. You're great. It's not that hard. It's just counting. $30,500. Anyone else at 35? All right, we're going to do 2 more levels then. Ready? How about $500? Who will say $500? How about this table back here that got me out of jam with 2,500? No? Thank you, sir. 500? We just did 1,000. You want to come in at 1,000? You can't hear it? Thank you. So, folks, if you can't hear, we're at 1,000. But this gentleman brings up a good point, which is any number that you scream out, we will accept your donation. 31,500. He's still at 1,000. Anyone else at 500? How about 500 now? Who at 500? Thank you, sir. Well done. That's 32,000. You guys can put all your hands up at once. You don't have to go one at a time. 32,000 and counting, all for Public Health Solutions tonight. 32,000. Anyone else at 5? Let's just do a couple more then. Ready? How about $500? This side of the room, Oh, sorry, we just did 500. Sorry, it's my first time in a long time. How about $250? $250? Anyone at $250? Where? All right, here they come, folks. We're at 32,000. 1, 2, 3, 4, 5. Keep the applause going for the 250s. How about the north side of the room? 33,000. And remember, you have to scan that QR code or you have to get your hand up. Thank you, ma'am, right here. Thank you, Table 7. We appreciate it. There's another. That's 33,500. And our last level tonight, folks, $100. $100 only. No one at... Thank you, sir. Folks, when the staff is donating, shaming you into donating, $100, surely, all the way in back there. Thank you, in back. I see you. There's one there at 100. Remember to keep your hands up or scan the QR code. And I will leave you with this. Here's one. Thank you, ma'am. Thank you so much. That's 34,000 and counting. I'm going to... Thank you. You came late, but you made up for it with your donation. We appreciate it. $100. And I'm going to leave you with this, folks. Remember, there's a QR code on the back of these little guys at every table and in the center, too. If you have no idea what a QR code is, flag down someone with a name tag on them. If you want to give any amount, $50, $100. If Jeff was in the bathroom when we started at 10,000, we'll take another 10,000. Thank you so much, guys. In the last 10 minutes, you guys just raised $34,000 for PHS tonight. That is not too shabby. Enjoy the rest of your evening, folks. Enjoy these gorgeous views, and good night.
Give it up for Charles, who just got us, what was it, 34 and change? Very, very good. A big thank you to everybody for donating so generously for the paddle race. And now we're going to be serving dinner. So enjoy your dinner in this beautiful atmosphere and us being face-to-face for the first time in a long time. And we'll be back at 8:30. See you then. I hope everybody is enjoying dinner. If you can kind of bring it down a little, I know it's exciting, but it's time to move on to the main presentation for the evening. Before we award these two presentations, where is Steve, who I spoke to? Steve, where are you? Steve. Oh, shoot. Steve, if you're here, stand up and wave to me, because I can't see. Oh, thanks, whoever's doing. Oh, there's Steve. Hi, everybody. Please keep enjoying your dinner. We're about to present two awards, but I made a promise to Steve, who came up to me during dinner and said he recognized my voice, and I told him I would give him one of my voiceover greatest hits, so here we go. Don't take Boniva and tell your doctor if you have difficult or painful swallowing, chest pains, or severe continuing heartburn, as these may be signs of serious upper digestive problems. Okay. I'm really proud to be here tonight as we honor the special folks who have helped us make strides in improving the health of our city through some especially challenging times. Tonight's first honoree, our Corporate Champion of Public Health Award, goes to Bronstein Properties. Please welcome back on stage PHS's President and CEO, Lisa David. You're welcome.
I love that voiceover. Thanks, Nancy. Okay, I'm proud to present the Corporate Champion of Public Health Award to Bronstein Properties, a corporate partner who has gone above and beyond in unprecedented times to demonstrate their commitment to health equity. A family real estate management business based in New York City, Bronstein Properties is currently managed by the second and third generations of the family, Barry Rudofsky, Scott Silverman, and Daniel Rudofsky. Together, they manage more than 6,000 residential units, along with numerous retail properties totaling over 5 million square feet throughout New York City. Health happens in neighborhoods, and as a real estate management business, Bronstein Properties understands how their work in building neighborhoods impacts our work in supporting health equity. To support our work, they donate a portion of the first month's rent for a new lease to support PHS and contributed staff laptops. And they contributed staff laptops at the start of the pandemic so that we could have our staff continue with that remote work without disrupting services. They also work with Centro Evangelistico in Inwood, a food pantry, to fight against the hunger crisis faced by New Yorkers daily. So, real estate with a very strong social mission and commitment. Please join me in welcoming Daniel Rudofsky and Scott Silverman on stage.
Sure.
You want to take a picture with the first?
So thank you so much, Lisa and the whole Public Health Solutions team for this great honor. We are thrilled to be here. On behalf of the entire Bronstein Properties family, Scott Silverman, and my dad, Barry Rudofsky, we feel privileged to be here tonight supporting PHS. We also want to acknowledge Dr. Ige and all the amazing frontline heroes. that have really been working their butts off to save us from ourselves, because that's what it feels like sometimes. So thank you. Fortunately, my dad is not feeling well tonight, and in this new COVID age was unable to attend, but he wanted me to convey his sincerest apologies as he was looking forward to seeing all of you and wish to share our gratitude to PHS and all of you out there who have supported us over the years and tonight. So thank you very much, and thank you, Dad, for he's watching, I think. We were first introduced to PHS when my mom, Karen, volunteered with the PHS affiliate, NYC Nurse Family Partnerships, a government-sponsored program designed to help support new mothers by providing valuable guidance to ensure a healthy pregnancy and a healthy baby. Through this, we all came to understand that while government-funded programs excel at providing basic medical care for underserved communities, they sometimes lack the flexibility to support health needs outside the traditional walls of a medical clinic or a hospital. That need to fund additional programs and truly help overcome health inequities amongst New Yorkers is what defines PHS, specifically the program you heard about earlier, Whole You NYC. For example, when my own grandfather was struggling with health issues and he returned home from a hospital, he was fortunate and lucky and capable of having his family by his side. They were able to take time off and spend days watching him. They were able to provide basic things like grocery shopping, and there are plenty of people in New York City who do not have that opportunity. When people leave the hospital walls, they tend to have no one necessarily who's there to look over their care, make sure they're making their doctor's appointments, making sure they're taking care of themselves as well. PHS is aimed to solve that problem by creating Whole You NYC, to provide better health outcomes by taking a holistic approach to medical care. It coordinates and facilitates non-medical support one needs as a follow-up to a visit to a clinic or a doctor. It brings together over 150 organizations that offer services throughout all 5 boroughs of NYC, which you can potentially see here tonight, ranging from food, housing, employment, legal aid, youth training and development, health insurance, maternal support, sexual health, to just name a few. But that only scratches the surface of what PHS does. Last week, we had the opportunity to visit the Sexual and Reproductive Health Center in Fort Greene and receive a tour of the clinic from the director, Sarah Blues. Yeah. We experienced firsthand the dignified care and attention that patients received by a team of medical professionals who were completely engaged in the process. But even here, we learned that there are still gaps in the funding, and so much more can be done from private funding. In fact, during our tour, we learned there was an unfulfilled need for an ultrasound machine in their Brownsville location that was limiting their ability to turn that into a full-service clinic. And this brings me to Dobbs v. Jackson, which is the case that was decided last week, which is still digesting, I think. It's an issue that's dear to our family and only reinforces the need to invest in our infrastructure in New York City, especially the sexual and reproductive health centers that PHS supports. Unfortunately, and I say that and I mean it, PHS is going to be on the forefront of ensuring that women across the country receive access to safe, affordable prenatal care. It's a shame that PHS has to do that, but PHS, we are lucky enough to be here to support an organization like PHS that can do that. They're no longer going to be able to drive down the street to their local clinic in Texas or Florida or somewhere else, and they're going to have to come to New York. But hopefully, through all of our support here, we hope to ensure that every woman that wants to in this country can take care at a PHS center and access to sound medical advice and can make healthcare decisions within the privacy of their doctor's office. And I think it's really important to us that PHS continues on that mission. So.
I think I have to put the mics down a little. Daniel's much taller than I am. It is nice to receive award tonight. It's the second award. The last one was 40 years ago, so I guess every 40 years isn't so bad as long as you get one. I'm really happy and thrilled that everyone could be here tonight, and clearly the work that PHS is doing in today's political environment is more important than ever, and it's a really worthwhile cause. I would also like to congratulate my fellow honorees, Dr. Olusimbo Ige and my brother-in-law, Barry Radofsky, who could not be here tonight. These honors are well-deserved. As Daniel had mentioned, we are thrilled to support such a worthy cause as Public Health Solutions. As a third-generation real estate family business, our mission has been to provide safe, well-maintained, and quality housing in and around the very neighborhoods that Public Health Solutions serves. As we all know, one of the key aspects to furthering one's life, raising a family, and being successful is stable housing. We are proud to do our part as a real estate business in providing that for these communities. While we try to do our part in providing stable housing, Public Health Solutions does so much more to help these very families and communities through their network. Some of the programs that PHS provides are community work, which is providing direct services within vulnerable communities to improve health outcomes, healthcare community partnerships, develop coordinated and accountable networks that bridge health and human services, other valuable programs such as food assistance, health insurance enrollment, maternal and child support, sexual and reproductive health services. I am sure PHS does so much more than the few programs I have mentioned to impact the changes and the lives of the communities that they serve. Again, we are honored and proud to help this very worthy organization and all the good that they bring. Before I finish, there are some thank yous that I would like to make. Obviously, thank you guys for all attending, your support, and attendance is heartwarming, and I am thankful that you guys could be here. I'd like to thank my in-laws, Albert and Eileen Bronstein, for having the courage, foresight, and confidence to start a family business that has grown over the past 50 years. I'd also like to thank my partner and brother-in-law, Barry Radofsky, who not only helps run Bronstein Properties, but works tirelessly to champion the causes of our industry through his affiliation with CHIP. I'd also like to thank Barry's son, Daniel, and my nephew, Daniel, for working as hard as he does to help move our business forward. He has stepped up during one of the most challenging periods we've experienced in our history and will be a valuable asset for many years to come. Lastly, I'd like to thank all the members of the Bronstein Properties family. All their hard work they do on a daily basis allows me to stand here today. Without their commitment and effort, our business would not be where it is today. Again, thank you for this terrific honor.
Tonight's second honoree, Dr. Olusimbo Ige, was and continues to be a true leader through the COVID pandemic and helping drive health equity in our city. To present the Champion of Public Health Award to Dr. Ige, please welcome on stage Dr. Torian Easterling, who is the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene. Oh. Wait a minute.
Good evening. Good evening, good evening. It is, can you hear me? Good, good. Good. It's an honor to be here with you this evening. I have the honor of celebrating with you tonight. Congratulations to Public Health Solutions. You all look great tonight. Give yourselves a round of applause. I certainly want to congratulate Public Health Solutions for all of the transformative work that they do in closing the gap and addressing health inequities across our city. We've been partnered, and I was just sharing with our table that we've been tied to the hip, or at least our agency has been, the New York City Department of Health and Mental Hygiene, and this wonderful organization, and making sure that we bring these transformative solutions into communities. And events like this are important because it's not just about the money that we raise, but it's also about the message. And the work that we all had to do for the past 2.5 years to keep each and every one safe in this room, 8.8 million people, has taken unprecedented collaboration. And so I certainly want to thank Public Health Solutions for all the work that they have done. Certainly staying on top of Dr. Ige and myself. Thank you so much, Lisa and Zach and all of you. But I think it's going to take so much more as we move forward. We are facing challenging times in our country, and so we cannot let up. All right, I'm going to get off of my soapbox and get to the task at hand. I have been asked tonight to present and introduce an award for a phenomenal person. Dr. Olusimbo Ige serves as an Assistant Commissioner at the Center for Health Equity and Community Wellness at the New York City Department of Health and Mental Hygiene, where she leads health equity programs to eliminate racial and other inequities resulting in premature mortality. As the branch chief for the COVID-19 vaccine equity program, she helped design and launch the Public Health Core initiative, a partnership with over 80 community-based organizations. Listen to this. That led to 93% COVID vaccine uptake in New York City public housing residents. As well, has led to 85% coverage in neighborhoods that have been hardest hit by COVID-19 pandemic. Dr. Ige has done hundreds of presentations to help educate New Yorkers about COVID-19 vaccines. For over 16 years, Dr. Ige led global health equity initiatives in several countries. One as Executive Director of Global Health for Global Ministries, overseeing 300 rural hospitals in 42 countries. She has led the United Nations Every Woman, Every Child program to reach 1 million children with life-saving interventions. She served as the USAID MAPS Capability Building Officer, working to reduce under 5 mortality in sub-Saharan Africa. Dr. Ige is a Commonwealth Scholar, was recognized as a notable alumnus of University of Manchester, UK. She's a public health doctor. She's a biostatistician. She's a public health physician. In addition to serving as an assistant commissioner for NYC Department of Health and Mental Hygiene, she is the co-chair of the vaccine subcommittee for the New York City's Task Force for Racial Inclusion and Equity. She does a lot. And so now that I've said all of that, on a personal note, because I've had the opportunity to work with this phenomenal person, there's a quote from Maya Angelou who says that I think a hero is a person who is really intent on making this a better place for all of us. Occasionally, our heroes are also amazing leaders who lead others with integrity and compassion. This hero and leader solves problems, but create lasting change. This hero overcomes obstacles, but also lead to teach others to find opportunity in adversity. And what else we can say is that our heroes achieve the impossible, but also enable others to reimagine the impossible. And so it is an honor. It is my privilege to present the 2022 Public Health Champion of Public Health to Dr. Olusimbo Ige.
Thank you so much. Thank you. Forgive me if I become a little emotional today. As the youngest of 5 children, my mom is here, my brother is here. From the backside of nowhere in Africa, who would have imagined me standing here, receiving a standing ovation? I couldn't have imagined saying, I work for Dr. Easterling. I call him my boss. Everywhere I go, I say, I work for Torian. Because if you don't know Torian, then you're not in New York. And I want to say thank you to my boss for seeing me, you know what it feels like to be seen? He saw me. He hired me. And he has supported me in this journey. Folks, I want to say thank you for this opportunity, but I will start with a story. I asked my husband, who is here, what should I say? He said, talk about 3 important things. I was like, what 3 important things? Like, you're not being helpful. He said, talk about 3 important things. So I am going to attempt to talk about 3 random important things today. But thank you, Michael Olufemi Ige, for accompanying me on this journey. It's been 20 years with this man. And I have dragged him all over the world. When I say I have been to 42 countries, I'm not saying 42 hotels. I'm saying 42 countries where there's no internet and there is no water, and he has stood by me. So I want to say thank you. So, my 3 random things. 1918, a great epidemic hit the world. The Spanish flu, called the Great Epidemic. It decimated the world's population. 1/3 of the world succumbed to the Spanish flu. Over 100 million people died. February 2020, a virus emerged on the scene with the same potential to decimate the world's population. So one scenario is, imagine 100 years ago where a virus just sort of leveled the world's population. Now we have another virus threatening to do the same thing. Now just let me help you get perspective. So COVID has impacted almost every country in the world. COVID, as at the last count, 6.3 million people have died from COVID. Now, listen. The United States alone, 1.1 million people have died from COVID. So for those who are good with math, that is, we are the #1 country in COVID mortality. The #1 contributed 1/6 of the world's death from COVID. Now, New York City, 8.3 million people. We have lost over 68,000 people to COVID, making us the 4th most impacted state in the US from COVID. So what is the story? February 2020, we were terrified. We were absolutely terrified. We were imagining a scenario where New York City could be leveled. We were looking at a virus tearing through our streets, tearing through our population. No one was spared. And then a vaccine emerged on the scene. And then we started to imagine a different world, that there probably is a chance to save New York City. And then I had this opportunity or privilege to lead the community engagement to have people accept this vaccine. Now, maybe all of us or most of us sitting in this room can say we're Americans. Have you tried convincing Americans to do things before? We don't like to be told what to do. So I had a job to convince people to put this vaccine into their bodies. And not just anybody, black folk, brown folk, who are like, there is no way you're putting that thing in my body. So we had to imagine, how are we going to get this done? How are we going to get people to imagine a world where we could sit together like this and eat sea bass? And it is delicious. and be able to smile and hug and interact with people, because 2 years ago we couldn't imagine doing that. Now we're here. So we were imagining a world where this could happen, but we had to imagine how to do it. And when Zach said it takes a village, it truly takes a village. Villages like Public Health Solution. They had a rapid response coalition, 200 CBOs, coming together, crafting messaging, doing outreach, sharing PPE to get the communities on board. Public Health Solutions was with us from day one, first with our test and trace work, and then with our COVID equity work, and now with our COVID disparities work. Pulling communities together, mobilizing communities to imagine. And we began to imagine. And we began to build these coalitions and partnerships. And we began to speak and encourage people. And we began to imagine recovery from COVID. Today, I stand before you in July 2021. The NYCHA residents, those who live in public housing in New York City, vaccination coverage was at 39%. Today, like Dr. Easterling said, NYCHA residents have the highest vaccination coverage in New York City at 93%. Higher than city average. Then we designated some neighborhoods at the Task Force for Racial Inclusion and Equity neighborhoods, 33 neighborhoods. And Public Health Solutions was leading the charge, working with these neighborhoods. We were encouraging them, cheering for them, sharing the data with them, showing up at the meetings, imagining a way out of the hole that we were in, that is COVID. And today, the same 33 neighborhoods that were at 40% vaccination coverage in July 2021 and now at 85% coverage. Now, these numbers, though impressive, is not the whole story. The story was that we wanted to close the gap. Public Health Solutions work is about health equity. That means some people are here 200 feet ahead, and some people are there 400 feet behind. And what we want to do is imagine a world where we converge in the middle. And the success story is we converged. We narrowed and narrowed and narrowed the gap such that those who were 20 points behind caught up and overtook. Imagine a world where health inequities can be reversed. So when we say Health Reimagined, I am so excited because now we have demonstrated what coalitions and collaborations and partnerships can achieve. And I want to say thank you to Lisa David for I was saying to my husband, she's so easy to work with. Thank you for seeing me. Thank you for the work you do. I was saying to the board members on my table that Public Health Solutions get it. It's not all the time that you see people who get it, who get the passion for health equity. Zach and Ariel and all the wonderful people I have worked with, I want to say thank you. So it's been an amazing journey, and I just want to celebrate and revel in it in a little. But I was going to say 3 random things. So I also want to say thank you. I have 2 wonderful sons. They're not here today because they were going to wear shorts and as no, we have to look pretty. But I want to say thank you to my sons. I have 2 powerful men who are imagining what the world will be like. And I am happy that I helped to shape that world for them to make it just a tad better for the next generation. So thank you to everyone who is in this room championing this cause. I said to my boss, see, this is how we can make money. We just hired the man who was like 20,000, 30,000 for coming and celebrating with us and sharing fellowship with us. Thank you, Public Health Solutions. Thank you, everyone. It's been an absolute pleasure.
Okay. Just talk amongst yourselves. There's going to be a little photo op, and then I'll wrap everything up. Oh, let me get out of the way. Oh my gosh, what an amazing night. I want to congratulate the Bronstein Properties and Dr. Ige. Is she amazing? And may I just point out that Dr. Ige used no notes, and you never heard the word come out of her mouth. I just want to say that. This was the first big in-person gala for many attendees today, and we hope we made it truly memorable for you. And it was my honor to be here tonight. I'm sorry I was late, but I'm happy to be here to launch a wonderful and important initiative such as Whole New NYC, and listen about the incredible work the network does from the real people on the ground behind it. We once again applaud the work of our inspiring champions of public health, Dr. Olusimbo Ige and Bronstein Properties, who are working every single day to advance health equity in New York City. Together, we're making a difference. Finally, I'd just like to say very quickly, one quick important thing. One of the reasons that I've come back and I love participating in these events with Public Health Solutions, just a quick thing, is that I love the fact that the word solutions is part of your title, because it can be very grim and the situation can be very difficult, and to know that you all are working actively to come up with solutions to help people with public health means a lot to me, so thank you. And thank everyone for all your contributions. Every dollar donated to PHS goes toward ensuring that people have access to the health care they need, regardless of their income or zip code. With your help, PHS can ensure that everyone has the same opportunity to make their own decisions about their health and their families. So, don't forget to visit the dessert reception and open bar before you leave. Also, stop by the bar area. We have a little gift for you from PHS. There's also still a photo booth if you want to take pictures. And you can still use your phones and scan the barcode at your table to make contributions. And thank you all for coming, and I hope you had a wonderful evening. Good night.